Broadcasting live from the Business RadioX studio, it's time for the GNFCC 400 Insider. Connect, build, and grow with the Greater North Fulton Chamber of Commerce.
I want to thank everybody for joining us today. We are doing a month of May of Thursday webinar series on important topics to all of our communities. And our first one, of course, today being our healthcare forum. We appreciate everyone being here. I do want to start just by introducing our sponsor today. Our sponsor, John Ray, who owns and operates North Fulton studio of Business RadioX. Business RadioX is a 13-year-old national network with studios located across the country, and he serves as the voice of business in the markets that it serves. John is the host of North Fulton Radio, Business Radio, and Alpharetta Tech Talk, both of which are available on your favorite podcast app. John also helps business owners who want to do their own radio shows and podcasts by producing, promoting those podcasts. He works with businesses such as Fraser and Dieter, Brady Ware & Company, and Morrow Family Medicine, among others. John also produces the monthly podcast of the Greater North Fulton Chamber, and that is called the GNFCC 400 Insider. We're excited about that. John also, in his spare time, operates his own business advisory firm, Ray Business Advisors, and is highly active in the North Fulton community. And we're blessed to have him serve on our finance and our executive committee here at the Chamber. John, we really appreciate you sponsoring today's forum. I'm going to turn it over to you.
Awesome. Callie, thank you. And thanks to you and everyone at the Chamber who has put this series together. This is really important work that you're doing. So thank you for that.
Thank you.
Yeah, absolutely. We're going to dive right into it. Folks, thanks for being with us. Thanks to those that are on the webinar and those that are listening live. If for some reason you get dropped off or you can't hear or something, you have an issue along the way, we are broadcasting this event live on northfultonbusinessradiox.com. There's a player there. You can go hit the play button and get into. And also we'll be recording this for later release, and it will be released under GNFCC 400insider.com. So you'll be able to find it there as well. So without further ado, I'd like to introduce our three distinguished panelists. First, from Children's Healthcare of Atlanta, Dr. Dan Salinas. And Dr. Salinas is the Chief Medical Officer for Children's Healthcare of Atlanta. He provides executive oversight for quality and patient safety, medical staff services, and affiliations. In addition, Dr. Salinas has worked closely with community providers to develop the Children's Care Network, one of the first pediatric clinically integrated networks in the country, for which he also has executive oversight. He has also worked to advance children's behavioral health and primary care strategies. Dr. Salinas provides visionary leadership for the clinical delivery systems and draws on his skills as a relationship builder and facilitator to forge strong relationships with physicians in Atlanta and across the state. He's a native of Houston, Texas. We're glad we stole him for Atlanta. And he serves on several boards, and he also lives here in the North Fulton area in Roswell. Dr. Salinas, thank you so much for joining us this morning. Could you tell us a little more about Children's Healthcare of Atlanta and what's going on right now, how the pandemic affects children specifically?
Yes, thank you. Thank you for having me. And Callie and Stacy and the Chamber, I really am honored to be a part of this webinar today. As was just mentioned, I am a resident of North Fulton. My wife and I live in downtown Roswell, so we love North Fulton. We've been here a long time. I wanted to start just by giving a general overview of COVID-19 in pediatrics, because it is different than in the adult world. So we've been impacted by COVID-19, but we've been impacted in very different ways. the good news for kids is that COVID-19 is a milder disease in children and rarely requires a visit to the doctor, rarely requires a visit to the hospital. The number of cases in Georgia, the percentage of cases in children has remained relatively low at about 1.5% to 2%. So the good news is that most kids with COVID-19 exhibit just mild symptoms. They usually, as I mentioned, don't require hospital care. But it's still very, very important that the preventive measures that we've all undertaken, like good hand washing and social distancing and things of that nature, that we still implement those in our kids. I wanted to share with you just some of the things we've done in our hospital, some of the ways that we've had to rethink how we deliver our care in our hospital as a result of COVID-19, because it has caused us to look at that. And one of the things that we've done, which is really unique for us, but very important, is that in our emergency departments and in our clinical care areas, we have cohorted patients that either have COVID-19 or are suspected of having COVID-19. And what we've done is any child that is admitted to us with a respiratory illness, with fever, et cetera, we have put them under what we call enhanced contact and droplet precaution. So we treat them all as if they could have COVID-19. We put them all in one unit, cared for by one set of nurses, one set of physicians, et cetera, to try to prevent the spread of that virus to anyone else. Although our staff is using, in that cohorted unit, when they go into a room with a patient on this enhanced contact droplet precaution, they are donning a gown, gloves, a special mask, and of course eyewear, because all of that equipment protects them against the way that COVID-19 spreads. So we've cohorted these patients in our emergency department and in certain areas of our clinical care areas. And what that has also done is it's helped us to conserve some of our equipment, specifically the N95 masks and other masks, because a staff member can wear the same mask from room to room because that mask is intended to protect them from getting the virus. So this approach has been really, really unique for us, but it's really helped us in many, many ways in our system. One of the things that concerns families and our staff is the safety of our facilities. And we've done quite a bit. We've taken many steps to ensure the safety of our facilities. So everyone that comes into a children's facility is screened, temperatures taken, and then a screen for symptoms is also performed. Also, everyone that comes into our facilities has to wear masks. All of our high touch surfaces are disinfected regularly. Everyone's encouraged when they come in to wash their hands, and we have foam and other types of hand sanitizer available throughout our systems. We've also put measures in place that keeps people 6 feet apart whenever possible. And the other thing we've done is we've limited visitors to only one caregiver per child, which has also helped to reduce the opportunity that someone could come in from the outside and spread COVID-19 inside of children's healthcare. There's also a lot of concern about the availability in general, about the availability of beds and the availability specifically of ICU beds and ventilators right now during this pandemic that we have had to address, that we've had to deal with. And thankfully, as I mentioned earlier, kids are much less affected by COVID-19, but rest assured that our hospitals are a safe place for these kids. We have more than 230 licensed ICU beds that are available through Children's, and plenty of ventilators that are available in the event that they're needed. And not every child with COVID-19 has to be in the ICU or on a ventilator, and we have adequate number of medical surgical beds also. I wanted to share just a couple of special things. As we have all dealt with this pandemic, we've had to keep our eye on the ball, as we say at Children's. And one of the things that we've continued to do is that we have continued to work on the building of this new campus at North Druid Hills and I-85. That is a hospital that's being built that'll be finished in about 4 to 5 years. That's a hospital for the future. And this epidemic, in addition to all the other things that we've learned, tells us that we need that hospital more than ever. So we've been able to screen that staff that's working to build that hospital, the construction workers and other individuals, on a daily basis to keep that workplace safe. So we've continued to move forward with that. The other thing I wanted to mention is that the pediatric offices in the community are also a very safe place. I know people have been hesitant to visit their physician and to visit the pediatrician, but what I want families to remember out there is that their kids need their wellness exams, their kids need their vaccinations. I think vaccinations, because we don't have one for COVID-19, I think they're going to have a new meaning for people. I hope that they do. And please visit your pediatrician for your child's well visits, for their vaccines. And then don't forget that sports physicals are going to be needed as school resumes, hopefully in the fall. And so be sure to get out and get your sports physicals as well. I'll turn it back to you.
Thanks, Dr. Salinas. Now I want to introduce Freda Hardage, and Freda is the director of Northside Alpharetta Medical Campus, and she's a director of Foundation and Community Services for the Northside System. And her responsibilities include all the daily operations of the Alpharetta Medical Campus, which consists of 3 medical office buildings, 100 plus physicians from multiple specialties. And her foundation responsibilities include comprehensive oversight for all fundraising, donor giving, community activities, and research grant writing for the hospital system. Freda has volunteered for many organizations. That's an understatement. She's done a lot in this community. We all know that. She serves as the first MARTA chair from North Fulton. She's president emeritus and board member of the Drake House and former chair and board emeritus for the Greater North Fulton Chamber. She has served with distinction on the North Fulton Poverty Task Force, Johns Creek Community Association, YMCA High Harbor Board, and Windward Rotary, just to name a few. Freda, thanks for being with us and participating on our panel today. Can you let us know what's going on at Northside and how you're adapting there to COVID-19?
Well, thank you for inviting me today. Let me just tell you a little bit that we can take a lot of what Dr. Salinas says and apply it to the adult population as well. Most of what we're doing is very similar to what Children's is doing as well, in that all of our facilities, including here in Alpharetta, when you walk in, you'll have your temperature taken. You'll be asked to wear masks to proceed wherever you need to go. And the Alpharetta campus here in North Fulton has remained open throughout this entire series. And we've become more the campus that dealt with patients that were sick with other disease issues at the time, so that we could pull them out and not have to have them go to the hospital campuses, but we could continue to treat them with what they needed. And so that's really where our focus has been. Starting this Monday, we did open up again for a small amount of continuing, for example, screening mammograms for those that have a standard every 6 month or every 12-month screening mammogram, that we don't want them to get behind on it because they may have a disease that they're treating or watching. And so we're open back up for that. So we have a new elective surgery schedule that's starting, and it's based on disease progression. And so we look at those patients that have been waiting for some type of outpatient surgery. Clearly, those that have some type of a cancer diagnosis or something that is a more urgent are the ones that are being addressed right away. No orthopedics yet. So it gives you some indication that, we are attempting to slowly open back up, slowly do what we need to do to take care of our community. But any urgent, emergent cases have been addressed the entire time. I did look at census this morning just at the Northside Atlanta campus because that's our Fulton County Hospital. And just so you know, patients with a diagnosis of corona, there were 39 in the hospital. Of that, 18 of those are in ICU. So 21 are in regular hospital beds. And we have 6 that are currently in the hospital that we're ruling out the diagnosis, but they're sick enough that they need to be in the hospital. So at this current time, we have 39 critical care ICU beds dedicated to corona. We could make more if we needed, but 39, and there's 18. So there's 21 beds available in critical care today at Northside Atlanta. So we geared up for the worst case scenario, and we have now started to slowly gear back down a bit. We're not unrealistic to think that things couldn't change with opening up some of Georgia at this point, but we're prepared for how we need to do that. And we hope that we can start to go back to normal. It'll be a while before we see normal again, but as we work towards that, we are doing everything we can to take all those same precautions that Dr. Salinas just spoke about.
Terrific, Freda. Thank you. Our next panelist is Jon-Paul Croom with Wellstar North Fulton Hospital, and Jon-Paul is the president of Wellstar North Fulton. Wellstar North Fulton is a 202-bed facility located in Roswell. Jon-Paul joined Wellstar in April of 2017, and Wellstar North Fulton is one of Georgia's only Level 2 trauma centers. It delivers services including cardiovascular services, women's services. They have a pain and spine center, wound care and hyperbarics, and an inpatient rehabilitation. North Fulton Hospital is a primary stroke center and an accredited chest pain center. Jon-Paul previously served as CEO for the 529-bed Central Mississippi Medical Center in Jackson, Mississippi, and opened the only burn center in Mississippi and increased the availability of inpatient psychiatric services at that facility. And Jon-Paul also lives in Roswell as well. Jon-Paul, thanks for being with us today. So glad you could be here. Give us an update on where things stand at Wellstar North Fulton and how you're managing this change.
Sure. Thank you, John. It's a pleasure to be here with all of you today and to be able to talk about healthcare in the North Fulton area. Wellstar North Fulton Hospital, very similar to what Freda and Dr. Salinas mentioned about gearing up for COVID-19. A couple of months ago, when we started rolling out the process, we added many beds, you've seen on the news with rooms being turned to negative pressure rooms by the use of HEPA filters. We probably have over 50 rooms that we added in addition to our regular rooms that were negative pressure with HEPA filters. Screening all employees coming in with temperature checks every day, asking about travel, although the travel is very limited for everybody at this point. And then visitor restrictions. I think Dr. Salinas mentioned that, at the children's hospitals, when we have pediatrics, usually there is obviously a visitor associated with that patient. At the adult hospitals, those visitor restrictions extend to really no visitors unless somebody is in an end-of-life situation. So in that sense, we have limited the number of people that are able to come into the facilities to just those people receiving care. And we know this has been a very difficult time for our community, especially when they have loved ones coming into the hospital. But I would say that most of the community members have been very understanding and supportive of this process. I also want to say on communities, we truly appreciate the outpouring of support for the communities, not just for our hospitals, but for those frontline people such as our EMTs and our police and our firemen. It's been it's been really a big growth of relationships among all of the frontline and the community during these past few months. At this time, as Freda said, we've kind of come out of where we thought that peak was going to be. We certainly expect that we might see other peaks throughout the year as Georgia continues to open back up. However, we are also prepared to take on additional patients. At this time, our patient load for COVID-19 has flattened out. It's probably flattened out about 3 weeks ago to where we are admitting about as many patients as we're discharging. So we're not growing, and but we're not seeing it shrink a lot. But at the same time, I think it is important for the community to know that COVID-19 has not, affected the healthcare community as a whole in the same way. And what I mean by that is while, the frontline, ICU, your pulmonologists, your critical care physicians have been very, very busy taking care of COVID-19 patients, there are many, many other physicians and independent physicians such as orthopedists and ENTs that have lost, up to 90% of their business. And they are, it's an important time to recognize that, there are a lot of patients out there that have put off their care. And we, as hospitals, we appreciate that because it gave all of us an opportunity to ramp up, to get more PPE, to get our testing procedures faster, to get additional test kits. But I think I would say that all of the hospitals in the Atlanta area are at the point right now where we're all in pretty good shape. And but we also know that people that have put off those treatments, we really encourage those people to consider coming back and talk to their doctor if they need a procedure done. We are set up in such a way to keep those elective procedures safe and separated from COVID-19 patients. We have here at Wellstar North Fulton, we have separate entrances for those patients, separate screening processes. For the most part, all of the staff are different than the staff that are taking care of the COVID-19 patients. And, in general, as a general statement, healthcare facilities have been very, very good over the years in knowing how to use PPE properly, wash hands properly, and prevent spread of disease, because we've had diseases existed long before COVID-19, and our professionals are very, very good at minimizing that risk. And so I would just kind of, end by saying that, we've taken a very collaborative approach. As Freda mentioned, Northside opened up this past week. Wellstar also opened up at the same time. There was a lot of collaboration that existed between the four major health systems here in Atlanta over the past several weeks, where our chiefs of surgery had discussions about when it was appropriate to start opening back up. And, I think there's been a lot of great camaraderie among the healthcare systems and trying to do the best thing for our citizens, but at the same time, recognizing that there are many other disease states beyond COVID-19 that need to be taken care of. But thank you.
Thank you, Jon-Paul. So let's get into some of the questions that we've received from our attendees. This is a good one to start. It's with about common myths. And Freda, maybe you can start on this one, and I'll let everyone else follow you. What are some of the common myths that are you hear that you can dispel that in terms of what's going on in North Fulton?
First of all, I want to say that I'm really pleased that we live in North Fulton, because I think that North Fulton has done an outstanding job of rising above and beyond in taking care of a lot of the COVID issues. And even now with the state saying that, you could open back up, I think you've seen a really slow progression of that, because people are aware of some of the real concerns that we have with this not reoccurring, with the small chance that we have here that it could reoccur we want to make sure that we do everything we can. So I want to applaud everyone out there and all the steps that they have taken to try to make sure that as they open up, they're doing the best they can. I don't know specifically myths that I would say, but I do think that I do want to say that I do encourage people that when you're out in the community, out in the public, that you are wearing masks. I think that masks protect you and masks protect other people. And I know that some people feel differently about that, but that's one thing that I feel strongly about right now, that I think everybody, when you're out, you should have your mask on. So that would be what I would say specifically, that I think some people feel like that's not something that we should be doing. But from all indications, I feel strongly about that. So
thank you. Jon-Paul, you want to go next?
Sure. I would just add on to something I mentioned earlier. I think, one of the myths out there in the community is, if you don't feel good, don't go to the ER because you'll get COVID-19. I think that, I think that is a big myth that really needs to be dispelled. And I will say that, healthcare workers, we are very, very good at minimizing the spread of any disease. Most of the patients we see in the ED do not have COVID-19, but our healthcare workers are all wearing masks, are all wearing PPE. We have hand sanitizers every 6 feet on the wall. And there's a lot of vigorous hand washing, which has really always occurred in the ERs. I would say, and I think one of the things about my friends that do not work in healthcare, they say, well, that's we're really proud of you for going to the hospital every day. And my response is I feel safer at a hospital than I do at many other places that haven't spent years and years perfecting PPE and knowing how to use it and wash their hands and that sort of thing. So I think I would say to as far as a myth being dispelled is your emergency department, your local emergency department is a safe place to go. You have to take care of yourself, and if you're having any kind of issues, chest pain, whatever, please get in and get that checked out, because we are seeing many, many patients that have put off services for weeks and are coming in much worse state than they would have had they just come in and gotten checked out. So.
Thank you, Jon-Paul. Dr. Salinas, what's your perspective?
Sure. A couple of myths that affect kids specifically. One is that if your child is admitted to Children's, they're going to be alone. And as I mentioned earlier, and this has made itself onto Facebook and the internet. So because of that, people think it's true, but it's not true. In fact, as I mentioned earlier, all of our kids that are admitted to the hospital are allowed to have one visitor with them at all times. And that's very, very special and specific for children. Another myth is about ibuprofen, that taking ibuprofen can make COVID-19 worse. And that is a myth. In fact, fever-reducing medicines like ibuprofen and acetaminophen are all safe to use in children. Another one that's somewhat interesting, this one pokes its head up with various diseases, is that COVID-19 can be spread by mosquitoes. COVID-19 is a respiratory illness. And in fact, what we should be worried about is making sure that we are washing our hands, socially distancing, wearing masks when appropriate, not touching our eyes, our nose, our mouth, and our face with our hands. That's why hand washing is so very, very important. But I can assure you, based on information from the World Health Organization and the CDC, that COVID-19 is not spread by mosquitoes.
I'm shocked to hear that Facebook is not a reliable source of information, but we'll move on from that. Jon-Paul, maybe you can start on this question. You mentioned a little bit of this specifically, and if you can expand on it, it would be great in terms of how the community has supported you during this time. And maybe you can add on ways that the community can help going forward, genuinely help going forward.
Yeah, I think, the most visible ways initially the community supported, I mean, almost immediately we started seeing, getting phone calls and deliveries of PPE, including masks and other types of PPE. And some of these that people had made, a lot of food. I think I've discovered more restaurants in the North Fulton area than I'd even known about with just the food delivery to our frontline staff. That has occurred for weeks now. Making sure that people that are working hard on the front line at all shifts, because we're a 24/7 facility, so weekends, nights, it's been unbelievable. The number of community groups, individuals, single families that have come out and made those types of donations. Also, community groups who put up signage. I'm sure everybody's seen the "We Are Heroes" signs that have been put up in front of hospitals and fire stations and police stations. It's nice. It's a nice way to connect with our community. We're very thankful for that. Thankful for that support. I think that the biggest way that our community helped, and I think this says a lot about the North Fulton area, is that our community started social distancing even before the shelter-in-place order, and I think as a result, we just saw a much faster leveling of COVID-19 cases than in some other places in Georgia. I know we see on the news about. And I've got friends that work at Phoebe Putney down in Albany, and they had a huge influx there. If you just compare the two different places, I think what our community was able to do and do early and do longer has made a huge impact. And we're thankful for that, because as hospitals, it gave us the opportunity to purchase more PPE, increase our PAR levels, also get rooms ready, create more negative pressure rooms, and frankly get our testing faster. When we first started out, we were working with a national lab company, and we were seeing test turnaround times of 7 to 10 days. Now we have in-house testing systems where we can test for COVID-19 and get an answer in less than an hour. And that's a big deal. And so I think how the community can help now is one, thank you for what you did to help us get to where we are today. But the other piece is please, get back and I know I'm kind of repetitive here, but take care of your healthcare issues. Go back and see your doctor, and let us take care of those other things while we keep you safe. And I think it's important to know that, hospitals are at a much better place than we were 3 months ago. So,
Dr. Salinas.
Share a lot of what some of the same comments that Jon-Paul made. We had a tremendous amount of community support with providing food for our staff and personal protective equipment and leads on personal protective equipment that really turned out to be very, very helpful for us at Children's. And I want to thank you all, those of you that participate in that, and thank the community for that. What the community can continue to do, it's just what Jon-Paul said, trust that your healthcare systems are safe for you to access care, in this case for your children. Remember the importance of pediatric visits, and remember that children can become anxious hearing about COVID-19 and about the pandemic. And that one of the best places, one of the safest places for them to discuss that if they're anxious is with their pediatrician. So it's so important to re-access the healthcare system right now so that we can continue as we all reemerge and reopen, we can continue to focus on our health and the health of our children in this case so that they can be healthy and ready and vaccinated and ready for school next year.
Terrific. Freda, what would you like to add?
I agree with Jon-Paul and Dr. Salinas, but I will say, and I apologize, I should have said this in my opening, but labor and delivery is obviously a point of contention for Northside, and we have made sure that we set up separate entrances for our labor and delivery patients, and those patients do get one support person that can come with them for that particular visit, and that person stays with them throughout the entire time so that they're not in and out and the visitors can't change. But I think that's important because it's a very important time in someone's life, and these are very unusual circumstances. And so I did want to mention that because people have been asking that question of me, and I wanted people to understand how we're handling that, as well as we've had many babies that have been delivered during this COVID pandemic.
John, if I could add one more thing,
please,
to what we've said. One of the things that the community can do is to please remember to continue to practice the safe measures that have been mentioned, that we have all practiced over the last few weeks. Even though the shelter in place has been lifted, we need to really continue to practice good hand hygiene, using soap and water, using alcohol-based hand sanitizers when soap and water is not available, making sure that we are still socially distancing, even as we venture outside into the open, to keep remember that these safety measures are really, really critical. And those are the measures that will actually help us to continue to prevent the spread of the disease, which then leads to fewer cases, fewer hospitalizations, et cetera. So that's one thing that the community can really help to continue to rally to help us to do.
Well, continuing on that theme, let's talk about PPEs or personal protection equipment, and I guess comments on their effectiveness and recommendations that you make, beyond what you've already mentioned. Freda, maybe you can start on this one.
Well, obviously, the effectiveness of the personal protection, everything that we've been doing, the PPE has been amazing. And Jon-Paul talked about it a little bit again. The community really rallied around that. And a lot of our construction companies and different companies that used it for other reasons within their company made sure that they supported the local hospitals and brought in a lot of PPE for us until we could get our own upscaled as much as we needed it to be. But I can't say enough about how important it is for everyone, whether depending on where you are. Healthcare workers wear a different level, but it's just been amazing. We're gearing up. I know that at Northside, I'm probably everywhere, all the other hospitals as well, feel like we have sufficient supplies right now. And we have not, even though we did have shortages at the very beginning, have not really had some of the issues that you've seen on television in New York and some of those areas. We were able to sufficiently give the equipment that our staff needed on a daily basis. So for that, we were very thankful.
Thank you. Jon-Paul?
Yeah, I would say PPE in general is very effective if you use it correctly. We throughout Wellstar, we track, individuals who work for us that have gotten COVID-19, and the number that have gotten COVID-19 directly from, patient care is very, very low. Most of the individuals within our system who have contracted COVID-19 most likely got it, from the community. So we go through a pretty detailed process with everybody, as they test out for that and how they got it and who they came in contact with. So I think the fact that people, at all times are wearing masks. If they're dealing directly with a COVID-19 patient, they would have on an N95. Typically have a N95, which would be covered by a face shield. Some people will use a second surgical mask to cover the N95. But the part I wanted to mention about using it correctly is that if you could have all of the best PPE equipment in the world, but if you'll see people in the community that will have a mask on and they may have it on their chin, which is. And which what's happening at that point, any COVID-19 they picked up on the outside of their mask, they're now just breathing it back in as I'm touching my face talking about this. But I did use Perel before I did that. I think it's also important, how you use it. If you're reusing the mask, are you not touching the outside of it? If people in the community, if you have a cloth mask, are you washing it at home, or are you just reusing the same thing over and over again? A lot of it's kind of common sense, but you have to kind of think through about how you use it. And talking about the community again, one of the things I see a lot in the community is people wearing gloves. I think we know that you cannot get COVID-19 through your hands. Even if you have a cut on your hands, you're not going to get COVID-19 through it. You might get something else, but a glove is not going to protect. And I think a lot of people will wear these gloves constantly and forget to wash their hands. They think they're protecting themselves, but in fact, you're touching all kinds of things with gloves. So we, in the hospitals, we really encourage, if when you're taking care of a COVID-19 patient, you're wearing gloves, but it's single glove use, you're taking them off, and then you're washing your hands. I think that's one of the things I would just encourage the community is use PPE, but really think about how you're using the PPE. And really, unless you're caring for a COVID-19 patient, really, gloves, it's probably better just to wash your hands, hand sanitize, and that's one thing. But PPE, good thing. Yeah, for sure.
Thank you, Jon-Paul. Dr. Salinas?
Sure. The only thing I'll add is just the term supply chain, and there's some of the unsung heroes right now in healthcare because they've had to work so hard. And at Children's, our supply chain team has really worked hard to keep up on a daily basis, multiple times a day, actually, with our levels of necessary personal protective equipment. And it's really, really critical that we know our supplies and that we know the daily usage of our supplies and how we're going to conserve our supplies. And we've implemented all of these measures at Children's to make sure that we have adequate PPE. And then to add to what Jon-Paul said about the community, remember that a mask protects you, but a mask also protects someone that might be standing next to you. If you're incubating COVID-19 or any other respiratory illness for that matter, like influenza, and you're wearing a mask, it also protects the spread of the virus to others around you. So that's another reason why masking is important. And I cannot emphasize more the importance of washing one's hands and how gloves out in public can give us a false sense of security, when in fact, washing hands with soap and water for 20 seconds, or when soap and water are not available, using alcohol-based hand sanitizer with 60% alcohol or more in it can really be a good line of defense against this virus.
Thank you. Why don't we get into the common treatment plans that are occurring at this point? And maybe Jon-Paul, you can start.
Sure. I think that we try to stay on the front end of all of the new treatment plans that are coming out. One of the interesting things that we are doing is convalescent plasma. A lot of people have been talking about this in the news. What convalescent plasma is that people that have had COVID-19 before donate their plasma, which is a system by which your blood is run through a machine, the plasma is taken out. I think the belief there is that this plasma contains antibodies, and what we've seen, at least at our hospital, is that as we use this plasma on patients with COVID-19, we have seen some reduction in the number of days that they're in the ICU. It just gives your body an opportunity to come back stronger, faster. And again, there's still a lot of studies, a lot of things being done. We at Wellstar, we are doing this through a study with the Mayo Clinic, and have had the opportunity to participate in that. And we are tracking our data as Mayo and other hospitals as well. to see how this is, will run in the long run. But we do think it's a benefit for the patients. The only other thing I would say to that is it gives us some hope that perhaps when we, start to do more antibody testing throughout the United States, that perhaps what it tells us is that as somebody has had COVID-19 and builds up antibodies, potentially it could help, in the future, particularly maybe even toward finding a vaccine, although we're not at that point or involved in that yet. But that's been the biggest interesting treatment for us. Our pulmonologists and critical care physicians spend a lot of time talking to their colleagues at other systems in Atlanta and throughout the United States about the latest drugs, the latest treatments to combat COVID-19. And I think it's just a lot of great professionals trying to stay on the front end and trying to understand what the next best thing is going to be.
Thank you. Dr. Salinas, I know things are different when it comes to treatment for children. Maybe you can address that.
The treatment protocols for kids are actually very similar to adults. The biggest thing is supportive care, of course, with fluids and oxygen and things like that if a child needs that. But also we have used convalescent plasma to treat a child with COVID-19. And then we've also used the frequently mentioned antiviral, which is used through investigational use, remdesivir. So the treatment protocols for kids are basically the same.
Freda?
I actually called a couple of our physicians yesterday to ask this question because I wanted to make sure, since I've been doing something a little differently. One thing that they are seeing that they think is very promising is called proning, which is a treatment that they're using specifically for coronavirus, and we're using it. And they have seen a lot of very promising results from it. Basically, that means that they're flipping the patients on their stomach, and that helps the respiratory secretions not pool in the back, which is where the better portion of the lung tissue is. And they said by doing that, they're causing a lot of gravity helps these secretions move. And they're finding the patients are responding very well to this. And it has helped patients not have to go on a ventilator. So this is a study that's being done across the country, and Jon-Paul, y'all might be doing this as well. But I did think that was something that was very promising and something that has come on the forefront during coronavirus. So I wanted to mention that we're doing that, and you guys are probably doing that as well.
Terrific. Let's talk a little bit about, and Jon-Paul, you brought this up first, I think, but time-sensitive, essential, and elective surgeries. Maybe you can start with this, how you're handling that, and what you're obviously encouraging folks to take care of themselves. Maybe you can expand on some of those issues.
Sure. Yeah. So when all of this started, obviously we as all hospitals put off, elective surgeries, things that were not critical at the time to be taken care of, needed to be, could be pushed back a few months. But throughout, we continue to take care of any, urgent surgery. As a trauma center, we still continue to get traumas in that have to be taken to the OR. There were certain types of procedures that also would continue. Say, for instance, if you had a cancerous tumor mass, that waiting weeks would not be good for your health. Those procedures were done, but we were very, very selective for a period of time. I think now we're at the point, as all the systems are slowly coming back on with procedures. I feel that we're in a place where we, can keep, people that want to come in for those procedures that they've put off, things such as, ENT procedures or certain orthopedic procedures. we have started to take a look at those and do those, on our patients. We still are looking at, patients with multiple comorbidities or people that are of a certain age where it might not be, wise to do that procedure at this time. And if we can still put that off a little while, we would. But those decisions are being made between the physician and their patient in conjunction with our ORs to make sure that we're making the best decision for everybody. I would say that with every patient now that comes to get a procedure done, whether it be in our OR or if they're coming to the cath lab, we do test everyone ahead of time. They would come a day or two ahead. We would run a COVID-19 test on that person, just to let both our team members know, but also that patient know whether they were currently infected with COVID-19. If they do test positive, we would ask that person to, if they were not sick enough to be in the hospital, we would ask that person to go home and quarantine for a couple of weeks, at which point they would meet with their doctor again and make a decision about rescheduling that test. If they test negative, we would go ahead and schedule that procedure, but still take all PPE precautions. So all the healthcare workers are still wearing masks. And the patients would be masked until it's time to do the procedure. So we're taking all additional precautions, even though we are doing the testing. But I think it is important for people to know it is safe to come back and do those types of procedures. But you and your physician will make the best decision for you, and we will work with you to get those things done. Thank you, Freda. What would you like to add?
It's pretty much the same thing as Jon-Paul. The only thing I would say is if you have either an employee or a patient that exhibits and gets a positive corona test, the rule is, you isolate for 14 days and people are like, so at the end of 14 days, am I free to move around? And our instructions are that you are symptom free for 5 days. Yeah. So for some people, it might be that you quarantine for 10 days, but you're symptom free for 5 days. You have no fever. You have no cough. You have none of the symptoms that you had prior to that. So for most people, it is somewhere around 3 weeks or so before they actually are completely through the process. That's not true for everyone. I think children, it's even less. Dr. Salinas can probably tell you. But our rule that we tell everyone is you need to be symptom free for 5 days.
Thank you. Dr. Salinas, anything to add on this one?
The only thing I'll add is with kids, there are so few procedures that are truly elective. So we've had to do surgical procedures all along the way in a very limited way. But as of May 4th, we've opened our surgical services back up and are taking all the necessary precautions to provide that surgery in a safe way in terms of COVID-19, et cetera. So we're open for surgery, keeping our system safe, and the kids are coming back in for their surgeries now into our system.
Terrific. There was a mention earlier of, now that Georgia is reopening, quote unquote, in various ways, the anticipation of more positive cases. I mean, I'm curious about your perspective on that and what you anticipate in that regard. Dr. Salinas, maybe you can start.
Sure, I'll be happy to take that. I think it's difficult to know. This virus is still present in the community. The reopening of Georgia, of course, was very important. What that means, though, for us is that we need to continue to be very vigilant and continue to socially distance ourselves, make sure that we're washing our hands or using alcohol-based hand sanitizers when soap and water are not available. We need to continue to do all of those practical things that we've mentioned that made North Fulton so successful in reducing the spread of this illness. We need to just keep doing that because the virus is still present. There are still people testing on a daily basis that are positive, et cetera. So the virus is present. So we need to continue to use our common sense and to do the things that we learned. And I also think that what we learned during this pandemic is going to be really helpful to us during flu season this next year and during other viral outbreaks, that I bet you're going to see more people washing their hands and even wearing masks. And no one ever wore masks, or very few people wore masks during influenza season. So if there's a silver lining, I think it is that we've learned a new way to reduce the spread of an illness. Social distancing works, and let's keep doing that.
Freda, do you have anything to add in terms of anticipating more positive cases? Any comments on that?
No, I think that I do get asked quite often because people say, but it's still going up. It's still going up. And I'm like, well, if you look at the daily update that they send out on, several different stations and all, that's true. But the testing, there's more available testing than ever before. So, of course, as you're testing more people, you're going to see more positive cases. So but the overall number of patients that are in critical care and needing hospitalization is less.
Jon-Paul?
Yeah, I think to Freda's point, that's right. I mean, the testing is going up, which makes it look like the number of cases is going up. But the reality is, I mean, if you think about when all this started, there were so few tests that a lot of people, were being sent home to quarantine. If they showed the symptoms, we were making assumptions that they had COVID-19. So I think that's absolutely correct. Also, to Dr. Salinas' point, I think it would be great to, as we get into the winter, that we actually have a low flu season because of people using PPE and washing hands more. He's right. We have diseases every year that are spread by touching and touching our face and not washing our hands. So I think that could potentially be a big silver lining. I think that. I think the thing we just want to caution everybody about is that COVID-19. It's just because the state's opening back up, it's not over. It's still there. We still need to take precautions. At the same time, we have to get back to work, and we have to figure out how we live with COVID-19 for the next year or so until we do see some type of preventative measure for the disease. But in the meantime, it is important that we continue to use our PPE, live our life. But just know that the healthcare systems, we're in a good place. We certainly expect to see probably a few spikes here and there, but we're prepared for it. But at the same time, we just encourage our community to take the proper precautions.
Question around the for businesses, business owners, executives that are trying to keep their employees safe. That's what y'all are in the business of every day. Obviously at your respective organizations. Talk about what kind of guidance and guidelines for healthy reopening you would recommend. Maybe some safety protocols that employers ought to be thinking about and implementing as their employees return to work. Freda, maybe you could start with this one.
I think everything that we've said these last hour is all very important, but the social distancing has got to continue. And this affects so many places. Cubicles used to be your best friend in some of our businesses where there could be so many people put in a small area through cubicles, and now cubicles are not our friends because most of them don't allow for 6 feet of distancing. So I think as some businesses open back up, they have to think about that and the safety of their employees and determining how best to address that. I've heard several people say that they never thought they could work from home, but they learned how to work from home. So there may be some changes as we go on in the future with that, but it's everything we've said throughout this entire thing that's still so important and will continue to be important to protect each other going forward. But the figuring out how to go back to work and keeping the 6 foot distancing is going to be extremely important.
Dr. Salinas?
I think every business, and Freda's alluded to this, every business is going to need to look at their business, their spaces, et cetera, and devise their plan. So I think it's going to be unique based on the business, the types of employees, the number of employees, et cetera. The one thing I would say is the CDC has excellent guidance on their website for businesses, and I would highly recommend that any business refer to the CDC guidance on what to do to make the workplace safe.
Thank you for that. Jon-Paul.
Yeah, I just reiterate what Freda and Dr. Salinas said. Both the CDC and Governor Kemp's office have put out great guidelines for businesses on how to protect yourself. I would certainly refer to that. And it's masks are great. Hand washing is so important. So if you're with your business, I would encourage you to have places where people can wash their hands frequently. Encourage that to occur frequently. And if you don't have ready access to hand washing stations, make sure that you have hand sanitizer readily available, and it just kind of becomes part of your everyday action. You do something, you serve a customer, you hand sanitize. It's just got to be something that's kind of comes second nature.
Thank you. I think we've hit the high points of the questions that have been submitted, and I'd like to thank each of our panelists. This has been terrific. Dr. Dan Salinas, Children's Healthcare of Atlanta, Freda Hardage, Northside Hospital, and Jon-Paul Croom, Wellstar North Fulton Hospital. Thank you so much for being with us, and thank you for your service to our community.
Thank you.
Thank you. It's been our pleasure.
Thank you.
Yes, thank you, and you're very welcome.
Thank you. And now I'm going to turn it back to Callie Boatwright. Callie.
John, thank you. And echo John's thank you to our panelists for being with us today, as well as thank you to our sponsor, John Ray and Business RadioX. Thank you for doing a great job with this panel. Just to make sure everybody knows, the chamber did go back into the office on Monday. My team is here. We are using CDC guidance, great documents, and we are also maintaining social distancing. And Jon-Paul, you'll be happy to know we have the hand sanitizer at like every place in the office. I know that's a big thing for you as well. So we also have some great resources. I know we have some great resources on our website as well. I do want to just let everybody know our next Thursday webinar event will be next Thursday, May 14th. It is a real estate market outlook amid the current crisis. So it kind of gives us an update of what that looks like from a commercial and residential standpoint. So just check the calendar at GNFCC.com and you can see all of the topics in this month, but that is our next one. I want to thank everybody for joining us. Again, thanks to our panelists and thanks to our sponsor, Business RadioX. We look forward to seeing you next Thursday.